My name is Katie Carter, and I live in a small town in Northern California. I have two children, and I even have a new grandchild, so you can imagine that I'm in my 60s. When I was 56, I decided to go back to school, and I chose Hawthorn University, mainly because it was online, but I'd heard so many good things about it, and a good friend of mine also was enrolled in the program. I just love what I'm doing, so my enthusiasm really shines through.
Welcome to Hawthorn University's webinar series. I'm Paula Bartholomew. I'm really glad you've joined me early. We just have a few announcements, some holistic health news, and we'll just have a brief conversation today with our presenter, Donna Wild. And at the top of the hour, we'll begin part 2 of Donna's presentation on physical observations of nutrient deficiencies of the skin, nails, and tongue. Our last webinar was April 5th with Donna Wild, and she presented part 1 then, and primarily focused on the tongue. We recorded that webinar, and we'll record this one too, so you can access them from our website, and you'll find it under archived webinars. You can find them anytime. This one that's being recorded tonight will be up by the end of the week. And just a reminder that everyone in the audience is muted, but we really want you to post your questions and your comments. All you have to do is type them in at any point in the presentation. Use your webinar panel. And at the end of the presentation, we'll have time for question and answers, and I'll present the questions for Donna at that time. I wanted to let you know all about alumni. It's an exciting new event that we're doing here at Hawthorn. We've had 3 shows so far with 3 of our webinars, with 3 of our graduates, and it's a 30-minute segment. We air live on Wednesdays at noon Pacific time, and it runs for 30 minutes, and then we have about 10 or 15 minutes for your questions and answers. And you're able to interact directly with the presenter here. So it's just really wonderful to hear what they're doing, the fabulous things that they're doing post-graduation. And each graduate gets to share their success stories, but they also talk about what challenges they've faced and that they've learned from. And there's a lot of encouragement coming from them too, as well as advice to really inspire the rest of us. On April 6th, Lori Ellis had some very inspiring things to say about her post-graduation experiences, and she shared a lot of her Back in a Whack program for teens. This is now a national program. It's primarily focused in Wyoming, but it's going national. So it's huge what's happening here, and I hope that you take a look at that. The recording's up on our website, and I'm just thrilled you get to learn more about the program and all Lori's doing, because she's just so terrific. And then on Wednesday, May 4th, I get to interview Tara Sheppy. She's a graduate also, and she's going to share more about breaking into the world of health and wellness. And this is just a great lunchtime opportunity. So I encourage you to prep your food, tune in, and join us live if you can. I wanted to talk just a little bit about Hawthorn's revised courses in our MSHM program, Master of Science in Holistic Nutrition. If you're looking for a comprehensive clinical master's program in holistic health and nutrition, I encourage you to check it out. Our website has a lot of detail about it. Students are giving us great feedback about it, so check that out. And there's a survey that we ask you to complete after the webinar. So if you stay for a couple minutes, it doesn't take long. And it's really an opportunity for you to give us your feedback about the presentation that's airing now, and to let us know what you'd like to learn more about in any upcoming webinar. And perhaps you'd have a suggestion if you know of a Hawthorn graduate that you'd like to hear more about. The survey is really a way to let me know about it. And I want you to know that I do pay attention to. It's the first thing I look at when I come in on Wednesday morning. So right away, and I'll write back if I need to. Okay. I think that's enough for one more thing on announcements. The National Association of Nutrition Professionals annual meeting is this weekend in Long Beach, California, I believe, and it's on oh my gosh, it's on a boat. Yeah, Alex, do you remember the name of this? visit the St. Anne. Anyway, I apologize for not having that detail, but the NAMP website, namp.org, you can go on there to click more details to find about the great food that they always have, all the presenters that show up with their wonderful workshops and topics, and certainly Hawthorn will have a presence there, so come check it out. All right, that's enough of announcements. I'd like to talk with our presenter for a little bit before we get to the top of the hour. So, hello, Donna. It's really wonderful to have you presenting with us again at Hawthorn University. Welcome.
Thank you, Paula.
You bet. I wanted to ask you about holistic practices, because you're somebody that really embodies this to me. And so would you talk a little bit about what you consider like the ultimate holistic practice would be?
I think it's to get the whole family together in the kitchen and prepare meals together. It's difficult to be healthy when you eat a lot of meals out. And with working women, they come home and they're very tired. Children and spouses into the kitchen, you can talk as you teach them important culinary skills. Even a 3-year-old can mix flour and oats in a bowl. They can also wash vegetables. And as they get older, you can teach them important knife skills and clean up. But it's a time that the family can talk about what's going on during the day and unwind together before they sit down and enjoy that meal.
It's really beautifully said, Donna, and I agree. To be able to bring families together around food and share what matters, it's so important. I grew up in a large family. There were 7 kids, so and my maternal grandparents lived right next door. So cousins down the street. There was never less than 11, 12 people at our dinner table at any given night. And it was a time just like that where the food was being prepared ahead of time and we would participate in it together, but to have everybody together in a reverent way, with respect for each other and for the food, we learned a great deal, and we were a very tight family, I think, because of it. And I think everybody in my family carries that on to this day of sharing time and making special quality time for family together. So thank you for sharing that, Donna.
You're welcome.
Okay, and you've got a great book out. We're going to talk about that a little bit as we get into introductions, but The Skin, Tongue, Nails Speak, Observational Signs of Nutritional Deficiencies is the title of your book, and you've generously offered to give a copy away to someone attending this webinar today. Is that right?
Yes.
All right. Then all you have to do is complete the survey. That'll get you in the ticket for opportunity to get a copy of this book. And so...
And please make sure, please make sure they put a mailing address, a complete mailing address on it, sure, so that I've got a good shipping address to send it to. And Absolutely. It will go out U.S. mail.
Okay. All right. We'll take care of all those details. No worries. I think that's it for announcements, and I'm ready to start the webinar. So if you've just tuned in, I want to welcome everybody else to Hawthorn University's webinar series, and thanks for joining us. I'm Paula Bartholomew. I'm the moderator for the webinar, and today we get to welcome back Donna Wild to share her research and her experience identifying the physical signs of nutrient deficiencies of the skin, nails, and tongue. I expect this to be an informative webinar as Donna discusses various signs that can be observed by looking primarily today at someone's skin as well as their nails. And I say this because looking closely at the nails and skin can be a really helpful assessment tool. It can reveal specific issues of the tissue, organs, or systems of the body. And this webinar is going to focus on the physiology of the nails and skin as an assessment tool. It'll show nutritional deficiencies that contribute to the abnormalities, as well as identify signs and symptoms for each of the deficiency, and then provide supportive food sources as well as the properties of the individual nutrients, and then specific nutritional, herbal, and dietary recommendations that are supportive to the respective underlying dystrophies. You know, I was reflecting back, Donna, it's like when we first met, it was at the Weston A. Price annual conference. And we so appreciated your presentation there and meeting you. And we got a copy of your book, The Skin, Tongue, Nails Speak, Observational Science of Nutritional Deficiencies. And we just discovered your love of herbs and good food, organic gardening, holistic lifestyles, and of course your bees and chickens. So I loved all of that. I love having you come back. And I'd like everybody else to know a little bit more about you and what you have to offer here. So, Donna Wild, I know you have some terrific information to share, and I want to turn it over to you and let you get started.
Thank you, Paula.
You bet.
So Paula spoke about my book. It's available on my website as well as Amazon. And also on my website, donnawild.net, I updated it with new information. And so go in and take a look. There's lots of handouts and literature to download on the site. But let's get started talking about the fingernails. If we're going to use the fingernails to assess someone's health, you have to start with the obvious. They can't have any nail polish on their nails, no extension, or fake nails. And it's very interesting that the people that use fake nails and extensions are the ones that don't have healthy nails that they can grow on their own. But the fingernails should be transparent with a shiny luster. They should be light pink in color and also have a smooth, even, convex arch to them. So let's talk a little bit about the vocabulary that I'll be referring to. The pink flesh under the nail is called the nail bed. It contains a lot of capillaries that bring nutrients to the root of the nail. The root of the nail is called the matrix. It's where new cells are generated that make the nails grow. What we call the fingernail is actually called the nail plate. And the lunulas are these crescent-shaped moons at the base of the nail right above the cuticle. And those are very important, and we'll talk about those as well. And then that ribbon of skin at the base of the nail, that's called the cuticle. And what that does, it actually covers and protects the nail matrix. The nails, like the hair, are composed of these dead cells that make up a protein called keratin. The mineral sulfur in the amino acids that bind together these layers of keratin actually give the nail their strength and rigidity. Between those layers of keratin are water molecules and fat molecules, and they make the nails shiny and gives them their pliability. So with that information, we can come up with a basic nutrition for healthy nails. We need protein, whether it's from meat, dairy, gelatin, or nuts and seeds, or beans. We need vitamins and minerals from very colorful leafy green vegetables. And I will be talking about all these colorful leafy green vegetables so much today. And not only the leafy ones, but squashes, because it's very important to eat 5 to 7 servings of these colorful fruits and vegetables a day to be healthy. And of course, the fingernails need healthy fats. Now, when I'm talking about healthy fats, I'm talking about a balance eaten every day of saturated, monounsaturated, and polyunsaturated fats, a minimum of 2 tablespoons a day from the diet. And of course, water. Everybody should drink water, 4 to 6 to 8 glasses daily. I have my clients add a little pinch of sea salt to their water. It helps hydrate the cells, but it also gives them a little trace minerals in their water as well. So let's talk about how nutritional deficits are seen in the fingernails. First of all, the nails grow 0.1 millimeter a day, taking 6 months to grow from the root to the tip. The nail bed contains an abundance of capillaries. These capillaries bring a blood supply and nutrients to the nail for the nail growth. So between that abundance of capillaries and the blood flow and how quickly the nails grow, we can use the nails as an assessment tool. So any dents, bumps, ridges, markings on the nail can be associated with nutritional deficiencies, but also certain diseases, which will not be discussed in this presentation. We don't have time to get into that. But also other pathologies or anything that is in the body that is not conducive to health. And something very important you need to rule out are pharmaceuticals. So you'll have to go online or read the inserts that your clients bring you, because a lot of pharmaceuticals, drugs, actually affect the fingernails. And of course, when you're doing a nail assessment, you need to rule out any physical trauma to the nail bed, or the matrix of the nail. So if they hit it with a hammer, if they got it caught in a door or a draw, you need to ask your clients about that so you don't see that as a deficit. Now, a lot of clients come into my office because they have dry, brittle nails. If you'll look at number 1, that's a healthy nail. You see it's got nice luster, and it's pink, and it's got an arch and a lunula. But look at number 2 now. That nail is chipped, cracked, and split. These are typical signs of a fat-soluble vitamin deficiencies, such as vitamin F and vitamin A. It can also be an iron deficiency or that lack of water to keep those nails pliable. Then, if your client complains about hangnails, look to a magnesium deficiency. And if they say, my nails just won't grow, besides a protein deficiency, look for a manganese deficiency. I also want to say that if your client tells you they're eating enough fats and they're eating enough protein, you do need to check to make sure they're digesting it and assimilating it. You may need to give them some digestive enzymes with hydrochloric acid, and if you feel they're not digesting and assimilating their fats, then give them some bile or a petane, or a cholagogue, which is an herb that stimulates flow of bile. And these are dandelion root, greater celandine, and also golden seal, just to name a few. But getting back to vitamin A, besides being necessary for the nails, is essential for the eyes. Vitamin A was the first vitamin discovered, hence vitamin A, but it was also called retinol because it's needed for the health of the eye, the vision, and also the health of the retina. Vitamin A is also needed for the immune system. The studies on children and immunity and vitamin A were done in the early 1900s, and they actually used cod liver oil as a source for that vitamin A. Vitamin A is also needed for the skin, for the epithelial tissues, which line the intestinal tract, and also the mucous membranes that line the respiratory tract. So this is a severe vitamin A deficiency, chorotomalacia. It usually occurs in children and people with wasting disease. And because of the lack of vitamin A, the retina and cornea dry out, soften, get ulcerated, and can actually get perforated. Acne is another sign of a vitamin A deficiency, as well as this goosebump-like appearance on the skin. Now, we know goosebumps to be an autonomic reaction. I'm not talking about that. I'm talking about this constant bumpy appearance of the skin. And as Dr. Lee always said, too little or too much of a nutrient gives the same reaction. So I stuck in this picture of an Accutane rash. Accutane is a synthetic pharmaceutical grade vitamin A that they use for acne. It's also a teratogen that gives birth defects. But a lot of times your clients will break out on a rash. It typically happens on the neck as well as the shoulders. It can also happen on the face or anywhere else on the body. So let's talk about rich food sources of vitamin A. The biological form of vitamin A is called retinol, and that is only found in the animal kingdom. So we talked about fish liver oil, which is high in vitamin A, D, E, F, and K, but vitamin A is abundant in organ meat, especially kidney and liver. And if you don't like eating liver, you can get a good grade grass-fed liver from a cow or a calf, cut it into tiny squares, freeze it, and just take those little squares out and eat one or two a day. If you make them small enough, you don't even have to chew them. You can swallow them whole. But of course, you can always use a desiccated liver supplement as well. Vitamin A is also abundant in dairy, especially butter and cream. And then there's provitamin A. These are your carotenoids and your beta-carotenes. They're abundant in vegetables and fruits that are rich in orange color. So carrots, cantaloupe, sweet potatoes, your winter squashes, apricots, all high in vitamin A, as well as pumpkin seeds. But vitamin A is also abundant in those leafy green vegetables, beet tops, mustard and collard greens, your lettuces, your romaines, your Swiss chards, your endives, spinach, kale, broccoli, all of those. Now, before I move on, I just want to say that to make that conversion of the carotenoids into retinol, it takes place in the enterocytes, or the cells lining the small intestines, in the presence of fat and zinc. So that's a reason to always put a pat of butter or a little bit of olive oil on the vegetables you eat. But let's move on quickly to magnesium. Magnesium is actually a nerve-relaxing trace mineral, and it relaxes the muscles of the body. So I use it for any type of muscle spasms, cramping, tension, and then I'll also use it to relax the muscles of the bowel. And I use that for people who are constipated or have incomplete bowel movements. Then I'll use it to relax the muscles of the heart in cases of arrhythmia, an increased heart rate, and increased blood pressure. But magnesium's also good for different types of depression, sleep problems, and headaches. So again, it's the same sources, those leafy green vegetables, this time summer squashes, your seeds, especially pumpkin, flax, sesame seeds, sunflower seeds, your vegetables, cucumber, green beans, basil, good reason to eat pesto on a regular basis, and my favorite supplement, blackstrap molasses. Then manganese is necessary for the pituitary to make its hormone and for the health of the pituitary gland. It's also needed for the ligaments to make them elastic and give them tone. It's needed for bile formation and also to activate enzymes and for catalysts that are necessary for the utilization and synthesis of nutrients in the body. And you'll see manganese, whole grains, brown rice, those vegetables, berries, beans, cinnamon and turmeric are very high in it, as well as pineapple. So let's move on to longitudinal ridges. I see this a lot in my practice, especially in the elderly. And it's basically a vitamin F deficiency. And if vitamin F does not help this condition, I then look to the heart because there's a heart insufficiency going on. Oops, sorry. And especially if you see these ridges on the ring finger on the left hand, because those meridians run directly to the heart, then I always treat the heart. The FDA doesn't recognize vitamin F anymore. They consider vitamin F to be essential fatty acids, which they are, but they're a blend of essential fatty acids that have a specific vitamin effect. Dr. Royal Lee likened this vitamin F to Dr. Weston Price's X Factor because they're found in the same foods and have some of the same effects. And the foods that they're in are the ones that also are necessary for fertility and gestation. But vitamin F drives calcium and minerals into the tissue. So I use it for all calcium assimilation problems, like dry, itchy skin, muscle cramps, muscle aches, anyone that tends to get sunburn or windburn or herpes when they go out to the sun, or even when they first start tanning. I'll put them on the vitamin F. And that diminished second sound. So if you listen to the heartbeat of your clients and you only hear love, 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 instead of love dove, love dove, love dove, you need calcium and F to drive that calcium into the heart to give those valves and the heart muscle tone. Vitamin F is also needed for the thyroid and the prostate. And isn't it interesting that the thyroid helps with calcium assimilation in females, and the prostate helps with calcium assimilation in men? Also, vitamin F has a lubricating effect, so I use it for dry or falling hair to nourish that hair follicle, but also to lubricate the synovial fluids and also the cerebral spinal fluids. Rich sources of vitamin F: egg yolks, butter, cream, lard, especially if these animals are raised on green grass, because chlorophyll is very high in it. You can also find it in caviar and roe, and it's unrefined, cold processed olive oil and nuts oils, especially almond and flax seeds, as well as avocados. So moving on to white spots on the fingernails, or leukonychia. We all know this to be a zinc deficiency. It could be on all the nails or just one nail. But I've also found in my practice it could be due to an excess sugar or refined carbohydrate consumption, because you need zinc to make that insulin to be able to utilize all the refined carbohydrates your client might be eating. I also see it in people that have immune system problems and tend to get sick a lot. But we also know that zinc is necessary for immunity. Other signs of zinc deficiencies besides acne are skin rashes. These rashes tend to be flaky, red, and shiny. A lot of times they happen around the mouth, the nose, and around the hands. Another skin sign of zinc deficiency is hyperpigmentation, where you get these dark spots on the skin. And left untreated and compounded with a fat malabsorption problem, you can see how now it's not only dark, but you get that flaky appearance on the skin. And then this is erythematous. It is a severe zinc deficiency. It's when the capillaries become inflamed, they start weeping, and they get ulcers, and it happens mainly in the lower extremities. And this is what happens to your diabetic clients as well. And could it be due to that same zinc deficiency that they had in the first place, and maybe developed a type 2 diabetes because they don't produce good insulin? Other signs of zinc deficiency is reduced sense of taste and smell. I give my clients zinc with the G factors of the B complex. In 6 to 9 months, they usually get it back. And people that are on allergy medications, there's a certain allergy medication that actually takes away the sense of smell, and we actually have to deal with their allergies and get them off their medication to get that back. Hair loss, stunted growth, late puberty. Other signs: they actually gave children in middle school zinc supplements before going to school, and they found they had better concentration and a higher IQ. It also deals with infertility, but in men and female, especially low sperm count in men. Zinc is also necessary for growth, development, and regeneration of any tissue, so especially wounds that don't heal. But more importantly, it's needed for the genes and how they express ourselves in our future generation. And it's needed for all nerve transmission as well. Probably the best source of zinc is red meat, whether it be beef, pork, or lamb, shellfish, especially oysters, eggs, those nuts and seeds, especially pumpkin seeds, beans, lentils, molasses, brewer's yeast, another one of my favorite supplements, rice bran and wheat germ, all excellent sources of zinc. Moving on to ingrown toenails, also known as onychocryptosis. These are very painful, and left untreated, they can become infected. So what I found that works for my clients is I like giving them a fat-soluble chlorophyll ointment or a good potent comfrey ointment. And I have them put the ointment on the area every day and cover it with a Band-Aid because chlorophyll can be very staining. Then I make sure they know to trim their nails straight across so that it doesn't grow into the surrounding tissue. Make sure their shoes and socks are not too tight. And if they don't keep their feet clean at all time, these ingrown nails will actually get infected and become even more painful. Now, I talked a lot about chlorophyll in this presentation, both using it internally and externally. And I just want to take a moment to talk about chlorophyll. Chlorophyll is actually, you know, the blood of plants. And it's actually one molecule different than human blood. Plant blood has a manganese molecule attached to it, and human has a heme or an iron molecule attached from it. And I just want to, and so I use chlorophyll as a blood builder, a systemic purifier, a blood purifier, and a fat-soluble vitamin because it has A, D, E, F, and K, just like your cod liver oil, only it's from the plant kingdom. I do just want to say water-soluble chlorophyll, they take the magnesium molecule off of it and put a copper molecule on it. That does not contain the fat-soluble vitamins, but it could still be used topically as a purifier. Now, remember we talked about those lunulas, those crescent-shaped moons at the base of the nail above the cuticle? You should have at least 8 out of 10 lunulas on your finger. If not, it could be an indication of low cellular oxygen levels. So these are the people that tend to get breathless when they run or go upstairs, or also people that experience altitude sickness. So I'm going to make sure they don't have anemia because it's that iron molecule that carries oxygen in the blood, but I'm also going to look for a vitamin E deficiency because E2 of the vitamin E complex actually takes oxygen from the blood and drives it into tissue. If it's not due to low oxygen levels, I'm going to look for poor circulation, so cold hands, cold feet, Raynaud's. And again, I will give them that vasodilating G from the B complex to help with that circulation, as well as probably cayenne. Cayenne hot pepper takes the heat from the core of the body and brings it to the extremities. I've also seen these lack of lunulas on clients that tend to do a lot of high potency antioxidant supplements. Take them off the supplements, within a month to 6 weeks, those lunulas come back. Let's move on to vitamin C deficiencies. This is periungual hemorrhaging. It's these small splinter type hemorrhages that form along the cuticle and under the fingernails, but it can also occur around the nails themselves. This is a sign of a vitamin C and P deficiency, and this really is preclinical scurvy and signs of scurvy. Other signs of preclinical scurvy include that pinpoint bleeding around the hair follicles, along the gums that we know as gingivitis, but I've also seen tiny little pricks of blood under the fingernails as well. So vitamin C was discovered in 1938 by Albert Svent-Georgi, and he won the Nobel Prize from it. And he basically said that ascorbic acid alone will not cure these signs of scurvy. You actually need the whole vitamin C complex, especially the P factors. And he named it vitamin P after paprika because he was a Hungarian and he used to give his clients and patients paprika powder, which is a pepper, to get over it. So vitamin P are your bioflavonoids and your flavonols. They actually strengthen the capillary walls. So I use them for any type of capillary fragility disorder, whether it's bruising, spider veins, varicosities, lumps in blood vessels. I tend to give it to people who are also on blood thinners, but I only use the buckwheat and not the vitamin C that also has vitamin K. Otherwise, they don't like the clotting factors. So we talked about it being anti-hemorrhagic because it actually helps with collagen formation. And vitamin P regulates capillary permeability, which is how the capillaries allow controlled substances in and out of their cell walls. Vitamin P is also antiviral, and I'm always looking for an antiviral supplement that I can give my clients. So here are some of the P factors: rutin, quercetin, citrin, nobiletin, hesperidin, catechin. You can read them all. Vitamin P is found in those red and purple and blue fruits and vegetables. Your grapes, your berries, red and purple peppers. I've already talked about buckwheat being an excellent source. Buckwheat is not a wheat, it's a seed, and it doesn't contain any gluten. But I will also recommend those OPCs from grapeseed extract as well. Another sign of vitamin C and P deficiencies is gingivitis, that red swelling around the gums where they actually bleed when you brush your teeth or floss. Left untreated, that vitamin C deficiency actually is needed for the collagen in the connective tissue. Without it, the teeth actually become loose and fall out. And this picture is someone that has scurvy. And as I said, ascorbic acid alone does not have effect on this. It might have a short-term effect, but not a long-term healing effect. Other signs, skin signs of clinical scurvy, is this telangiectasis, and it's actually spider veins, but also called road mapping, and it can happen on the face or other parts of the body. Also, capillary-itis. The capillaries get inflamed and they break. This can be painful, and it happens a lot after exercise from a nutritional deficiencies, but also some pharmacal drugs can cause this. And then this which is that pinpoint bleeding around the hair follicles, and corkscrew hairs that are very painful, especially in men. So you know I like to diagram and talk about whole vitamin complexes. So here's the vitamin C complex. Vitamin C does contain ascorbic acid. Being an acid, it actually protects the other factors that are part of the vitamin. We talked about the bioflavonoids or vitamin P, but when vitamin C is found in our food, there's also vitamin J and K in there. We know vitamin K to be a fat-soluble vitamin that helps with clotting and coagulation, but it's also in the C complex when it's found in food. And then tyrosinase is a copper-based enzyme that actually activates that whole vitamin C complex in the body so that it can be absorbed and utilized. Rich sources of vitamin C are very similar to those with vitamin P, except for citrus fruit. And that white membranes under the skin actually contains more vitamin C than the lemon, the lime, the orange, the tangerine, the kumquat that you'll be eating. Of course, those colorful berries, cherries, tomatoes, anything that's red is going to be high in vitamin C, your rosehip and acerola berries, but raw mushrooms are very high in vitamin C. Vitamin C is very fragile. It gets destroyed by light, heat, air, and even sitting for too long. And I'm a fan of letting my clients eat potatoes, especially if I have them off of gluten, but I have them steer away from those russet potatoes and have them eat the golden, the red, the rose, the purple fingerlings. These are all very high in that vitamin C without a lot of the starch. So that's it for today's presentations. I'll take your questions, and also you'll see the references, some of the references that I've used. But in my book, everything is heavily footnoted, so you can look at the references in there as well.
Thank you, Donna. So we have some questions. I like the way you framed this in the beginning, of the importance of looking at the nails in their pure state without nail polish, etc., extensions and things like that, and that the people that often have the polishes, the nails, or the extensions may be the ones that are trying to cover up some poor nails to begin with. Certainly that was true for me.
Excuse me, little do they know that the reason why they have those poor nails is because the body is lacking in nutrients.
Yeah. Yes. So not everybody does it because they have poor nails, but it was certainly the case with my mother, and the first time I saw her with extensions, like, what have you done? And she said, well, my nails are so bad, so I put these on. And she said, I thought they were just, I could just take them off at night, but she said, they're glued on me, Paul. I don't know, I think I'd need some kind of super glue on that too, because it took us some effort to get those off of her and start nutrifying her and getting her
Plus,
some.
they're toxic. Those glue
Right.
polishes and nail polish remover, they all contain toxins.
A lot, really a lot. So that was another educational piece for that. So thank you for that. You talk a little bit about the matrix and the different parts of the nails. I wonder if you could talk a little bit more about the matrix and what it is and its underlying kind of foundation for everything with a nail.
Well, as I said, it's the root. And so the nutrients come into that matrix and they come together to actually form those fingernails. So that's where the new cells of the nails are generated from.
Mhm. And so then having a cuticle that actually covers the matrix begins to make some sense. What happens when people, they go and they have their nails done or they're doing their own nails and they push the cuticle back? Is that, are they putting the
That's
matrix at risk?
interesting. Because you're exposing the matrix, and I get a kick out of my clients when I look at their fingers and they don't have the lunulas, and they said, well, if I push back my cuticle, I'm sure there's a lunula there. And we're really not supposed to push back those cuticles. And what I recommend, and I'm sorry I forgot to say this, is I recommend my clients, especially for hangnails and dried hands, to put coconut oil all around their nails and their cuticles, and it actually softens them. And I find that they don't have large cuticles that they have to push back because of that. Also, coconut oil is antifungal, so it's good for any type of nail infection, which I find with my clients, they usually get those fungal infections on their nails when they get pedicures done.
Yeah, good point. All right, some questions here about zinc. Can it be a lack of, with zinc deficiency, can there be a lack of pigment? So you talked about discoloration of the pigment. Can there be lack of pigment? Like in a pale scarring, with scarring when it's really pale instead of dark? That would be one example.
No, lack of pigment usually comes from the adrenals. Of course, it could be scar tissue from chicken pox or something like that, those white spots.
Mhm.
But for that vitiligo, I looked always to the adrenals, the liver, and I give them chlorophyll because chlorophyll helps with the pigmentation of the tissue.
Mhm.
And even dogs who start to lose their black nose and it starts to turn pink, you might want to start giving them some vegetables mixed in with their food and look to their adrenals as well because that's a sign of adrenal insufficiency.
All right, great. Great response. And Dulcie, if I posed your question right, I'm glad. If not, let me know. We'll get that back in there. All right, then, in terms of the diabetic skin rash, as a result of zinc deficiency, will the rash be extremely itchy? Have you found that?
Okay, the rash isn't really for diabetes. It's more of those erythematous, those ulcers and the pus, weeping pus that happens in the lower extremities. Those rashes are basically zinc deficiencies. And as I said, they happen on the wrist, around the mouth and nose. They can also happen in the groin areas.
Mm-hmm.
They're not really itchy unless they get real flaky, but they're red, they're annoying, and if they don't respond to topical cortisol creams or a moisturizer, then you know that it's a zinc deficiency and giving them a zinc supplement, because zinc's a transient mineral. It really doesn't build up in the body for very long unless you're talking about zinc from a heavy metal source, and then it can build up in a toxin. So we need to give people that have these deficiencies zinc supplementation, and usually within 3 to 6 months those rashes tend to go away.
So do you not see zinc deficiency with diabetes?
Yes, there are different signs. White spots on the nails. There, zinc is also needed for vision. They tend to lose their vision. They also have a lot of nerve pain. And as I said, zinc is needed for the nerves. It's needed for the eyes. They have a lack of immunity. You see zinc deficiencies in these people early on. And throughout. You just have to be observant of it. But anybody that has blood sugar problems, you're going to give them zinc. You're going to give them some digestive enzymes. You're going to give them chromium, and you're going to give them B vitamins, because you need all that to be able to make insulin.
Right. Okay, back to nails. Talking about ridges in the nails that run laterally from side to side. So you covered the longitudinal nails, but what about lateral runs?
Yeah, those are usually bowlines, and they tend to be dipped. And the reason why I didn't cover them is because they're not really a nutritional deficiency. They're more disease states. I've seen them in people that had scarlet fever as a child, or rheumatic fever, or tend to get high fevers. I've seen them in people with parasites. I've seen them in clients who have yeast infections. They're related to so many other different conditions, and I list them all in my book.
Great. All right. All right. Okay, good things are making sense here in terms of responses that we're getting in. So vitamin C and oils for the nails, is that beneficial other than for hydrating purposes?
The water? Well,
the vitamin C and oils, topically, using topical vitamin C and oils for the nails.
I didn't say, I said using topical coconut oil for the nails, not vitamin C. Did I not say that right? You take vitamin C internally to help with the nails and rebuild the collagen.
Okay.
And you also want to do your fats internally, but as I said, you can for those cuticles, for hangnails, for dried hands, for those fungal infections that affect the fingernails as well as the toenails. That's why I use the coconut oil.
Okay.
Sorry, putting it on topically is not going to help with the hydration of the nails or with their pliability.
Okay, thank you for that clarification. What are skin-colored and translucent skin tags indicative of? Also, seborrheic growths.
Oh, wow. We're getting into a lot of different things now. Okay. So let's start with skin tags. Usually with any type of growth, look for a yeast infection. They're always there. So I treat the infection topically, and then there's herbs and ointments that people can put on to get rid of those skin tags. You might also look to give vitamin G or the P, because there could be a viral component to that as well. And seborrhea, that's weeping, oozing, oh my goodness. You have to take care of the underlying infection. I would probably put vulnerary ointments on those. Vulnerary are wound healing ointments. Heal All. let's see, what are some of the vulneraries? Comfrey, which we never use in cases of cancer, by the way, because like chlorophyll, comfrey is also a cell proliferator, but why I like to use it on the skin and pack it in some of these wounds that are oozing is because these wounds are very painful, and chlorophyll and comfrey actually deaden nerve pain. But again, you're going to have to treat while doing things topically as well.
Okay.
And I'm sorry I couldn't get more specific. I would probably give them lymphagogues to get the lymphs draining.
Mhm.
Let's see, what are some common lymphagogues? Cleavers is one that I like to use because it's one of the safer ones. Flaxseed oil actually is a very thin oil that will thin the lymph, so you could use things like that as well.
Thank you. Back to lunas. Can somebody actually form one if they don't have them now? On average, how
Yes.
long does it take?
Wow, some of my clients come back, and I don't see my clients on a weekly basis, so I usually have them come back every 3 months,
Mhm.
sometimes 6 to 8 weeks. But a lot of times my younger clients, they'll come back by the next appointment if we give them the right thing, or they'll start to come back. So it's figuring out what's going on and treating that deficiency,
Mhm.
or improving the circulation, or seeing what other supplements that they're taking on their own or that someone else might have put them on, and taking them off of those high antioxidant supplements. Especially the synthetic ones. I prefer using whole food supplements because they have all those other cofactors and enzymes so people can utilize their foods. Where with synthetic, you're getting a racemic blend of right spinning molecules and left spinning molecules,
Mhm.
and you don't always uptake all those because vitamins act as a catalyst. They're a piece to a puzzle. That spin is very specific. So at best, you're only utilizing 50% of that pharmaceutical or high potency blend. The rest is expensive urine, but also it creates other deficiencies because if you don't have those cofactors in your diet while you're taking those high potency supplements, it will actually rob your tissue to be able to utilize them and create other deficiencies.
So if somebody was doing supplements, I usually recommend that they eat the whole food version as well, so that they get the whole complex.
Yes, and sometimes you need to use something high dose to begin with to get them over the hurdle, but only for short periods of time.
Yeah.
Because what I find is those high dose synthetics don't have long-term healing like food-based supplements do.
Right. And it's interesting that you've identified a few things as supplements, brewer's yeast, blackstrap molasses being your favorite supplement. I never thought of them as supplements before. I always think of them as food. But using them, really specifically like this, I'm beginning to understand your use of the word.
Well, these were traditionally used in the 1960s before food supplements bloomed or blossomed. And so these are the types of foods we used to eat and things that we would add. And I find so many of my clients like that option. If they're not willing to do it, I'll give it to them in a supplement form.
Yeah.
But for those that don't like taking pills or get tired of it or want other options, or these supplements can get very expensive. So I tend to be very aware of people's budgets, especially when I want them eating fresh organic produce whenever possible. And that grass-fed beef or meats and eggs, they're very expensive. So we need to pick and choose and understand that our clients are on a budget and where they should spend their money.
Yeah, very good point, Donna. I appreciate that too. It's often missed. And start with a client. They'll come in, they've got a shopping bag full of things that they've collected over time. And yeah.
And a lot of them are expired.
It's true, and with very dusty caps on it, but okay, case of it. So brewer's yeast, Ted wants to know what kind of brewer's yeast you recommend for a non-GMO organic brand.
I like Lewis Labs.
Yeah.
Lewis, and it's non-GMO. They're raised in Bulgaria on beets, and that's why I like it. It's whole foods. I don't know if it's raised organically, but I see my clients, especially those with low energy, they just take a teaspoon and put it in their mouth, swallow it down with a glass of water. Within minutes, it picks up their energy. And my clients have told me that sometimes it takes 2 tablespoons a day for them to actually see that increase of energy.
Right.
But not everybody likes the taste.
Sure.
They can mix it in their green drinks or smoothies. They can sprinkle it on popcorn. They can sprinkle it on their granola. Nothing too hot. You don't want to destroy those precious nutrients. Now, Louis, they do things so their new formula is not as high in nutrients. So they say, or so maybe that's just what they put on the label. But basically, these nutrients are probably there, just not in the amount that used to be there.
See if I can get somebody to research into this a little bit more.
Thank
a
you.
school assignment or something to get us the answer. What's going on with Lewis Labs anyway?
Because I contacted the company years ago when they basically were out of it. You couldn't get it anywhere, not online, not in health food stores.
That's because you and I were telling everybody to use it. We upped sales. We should get some stock options. Anyway, so dandruff, is it indicative of a vitamin mineral deficiency in your opinion?
No, actually dandruff is a fungal infection on the scalp, just like cradle cap was, and I went over this in the last presentation. But of course you have to treat it internally by rebalancing the gut flora and the flora throughout the body.
Yeah.
And even the skin and the scalp has its flora. But what I also recommend my clients to do is to rinse their scalp with vinegar. Vinegar's antifungal. Just be very careful. Don't get it into your eyes. It will burn your eyes. But you can actually put a little vinegar, rub it into your scalp. It actually washes your hair. And I'm wondering about people's shampoos and if some of the shampoos they're using is actually killing the flora on the skin, the same way all these antibacterial soaps are destroying the flora on the skin. And nurses and people who work in hospitals all now have this dry, cracked skin because they lost that protective layer.
Yeah. So there's benefit to multiple hand washings, and we're grateful for that. But the antibacterial everything, it's stripping our microbiomes.
That's correct. Correct.
All right.
Not only that, it's been shown to cause hypothyroidism. It affects the thyroid.
You talked about some doses of different medications, or if somebody's looking to take some of the supplements, or you have a recommendation for adjusting dose per body weight?
Oh, it depends on the brand of the supplement, but I usually do half an adult dose for children 10 years and under. If they're over 10, a lot of times I'll give them a full dose. I also muscle test, and I muscle test for a dose, and I know not everybody does that, But what I find is one too many tablets or one too little tablets will actually make their muscles go weak.
Yeah.
I'll also start them for my clients that are very sensitive to everything, even if I muscle test them. I start them with one pill a day. And I might start them with one of something very specific, usually a probiotic, so that I make sure that they can digest and assimilate things that I'm giving them. And if they don't react, then I'll add another one in after 3 days to a week of a different supplement. And then I build them up to a dose of tolerance. This is especially important with iodine because a lot of people react to iodine.
Yeah. Yeah, it's a significant issue with thyroid concerns too. Thank you for that. It's a very cautious approach, and I applaud you for it. So many people just walk out of a clinician's office with suggestions for 10 or 15 different supplements at very high dose to start. And how do we know what's helping when you take so many different things and make changes?
Actually, can I make a comment regarding that?
Sure.
Because I trained doctors for years in muscle testing. If you take too many supplements and at high doses, instead of balancing the body so it can heal, it mandates function, taking more energy away from people. And I found with doctors that couldn't muscle test, if I took them off of half their supplements, they then became electrical and then could test.
Interesting.
So I'm not a, although I do have some clients, especially those with autoimmune diseases that still have a very stressful life, they are on a lot of supplements because it keeps them going until they're ready to make changes in their lifestyle to reduce their stress. Or for people that are too sick and too tired to cook, if they can't cook their own meals, then they're going to get more supplements. So it's dosing is such an individual, it's individual for everyone, in my opinion.
Yeah, I agree with you. So one of our attendees wants to learn muscle testing, and you just said you've taught a lot of doctors. I wonder if you teach practitioners still, or if you have a recommendation for a course or somebody, if you want to speak just in generally about muscle testing, because I certainly think that there's value in it. I think some people can do it very well. I think most people don't at all know what they're doing, and it can be risky, as with anything that, a little bit of something can be problematic. But it is an art and a science, and you want to be very, very good at it. And I never use it as a standalone at all. I'll use it to complement other assessments.
I don't use it as a standalone either. My clients probably come in with 12 pages of assessment forms I have them fill out, as well as any hair analysis or recent blood work that they might have. Any food allergy testing, I have them bring that into me, and I look over everything and put the pieces of the puzzle together. But what I sometimes find is the body, when I muscle test, has a different set of priorities that it wants to take care of beforehand. But getting back, there are teachers that do it. I basically can't recommend any off the top of my head, but look into different classes. What I always say about muscle testing, though, is you're just a vessel through which information flows. You can't have any preconceived ideas. You have to be healthy. You need to be grounded. I meditate, pray, and do clearings before that I do it. And if you're not healthy, any of your conditions can actually show up on the person you're testing.
Yeah.
So you have to be very careful, but also a lot of times I just test myself to see where my weaknesses are, especially if I muscle test 2 or 3 people in a row and find something, then I'm going to use their arm and test myself to make sure it's not me.
Interesting.
But yes, so those are just a few tips on muscle testing. Maybe I'll do a muscle testing class again. We'll see.
Great. Well, I don't think it's conducive to an online format.
No, it's not.
I wish it was. Yes, we'd set that up. If we could do a virtual, stick your arm out and we'll see. We'd play with it here, Janet. But we'll do our best here to see if you can find somebody that is suitable for you to work with in your area.
And I'll think about it, and maybe at the next one, or I'll email you. There are people that do it. I'm too particular.
No, I agree, and I agree, and I want that caution around something like muscle testing. So you want to be careful who you're learning it from, just like your nutrition.
That's correct.
Here's a good question. Aside from nutritional deficiencies, can the nails show signs of accumulated toxins?
Yes, they can, like those bow nails, breaking nails, brittle nails, black lines through the nails can be some drugs. It could be melanoma. It could be toxins. They can look black and actually be that pinpoint splintering or those multi-splinters of a vitamin C deficiency.
Yeah, make sure they haven't been working in their garden first and it's just good soil underneath there.
This time of year, my fingernails are always dirty.
You bet. That's why I'm cautioning it. So do you cover this more, Donna, do you cover this more in your book in terms of accumulated toxins?
Yes, I don't get into the cancers and the melanomas because, that's outside of our scope of practice. But in the reference, there's an article from a magazine, a professional journal, and it's the only magazine article in the references, and that one goes into a lot of detail about that.
Okay, great. Yes, there's reason to be careful.
Psoriasis and eczema and how arthritis affect our fingernails. Did I lose you?
No, I'm right here. I'm looking at questions. Sorry. And was there more about various disease states that's covered in your book as well?
Yes, there is, and also nutritional recommendations and diets to heal those disease states.
Okay, we'll come back to this book as we wrap up. So I'll give the title and everything again. Well, right now it's The Skin, Tongue, Nails, and Speak: Observational Signs of Nutritional Deficiencies by Ms. Donna Wild. A few more questions here. Just a second, sorry. With zinc deficiency and the hyperpigmentation, could that be a hormonal influence as well with the hyperpigmentation?
If it is, it's due to the liver, my guess is. Okay, I don't have an exact answer. But if it is, my guess would be coming back to the liver. Remember I said it's the adrenals and the liver that has to do a lot with skin pigmentation. Right. So I use that for brown spots. Anybody that has those brown spots, I always do liver, adrenal support, and chlorophyll. But where were we going with the skin discoloration? Oh, if it's hormonal, the reason could be that the liver conjugates all those excess hormones in our body and flushes them out with the bile. And then if you don't have sufficient fiber in your gut, those hormones will actually get reabsorbed. You need that fiber from all those fruits and vegetables that you're eating to flush those excess hormones out of the body. So again, it all goes back to the gut. It goes back to the bowel, the intestines, and the liver.
Interesting about that, and looking at skin, hair, and nails here, have you studied the face and and assessing lines of the face. You know, I know.
Yes.
Mhm.
Is it Miso Kusho's book that does the one on The Face Never Lies?
Yes, exactly.
Yes. Oh, an
One of my-
excellent book, and he gets into a lot of good diet and foods and raw milk, and
Mhm.
yes, and it's still in print. I think it's only about $10 or $12. It's an easy read and very informative.
Yeah, it's good. You know, I'm just thinking of you were talking about liver here and the lines that tend to come up above the between the eyebrows that are really so prominent with liver and marks around we call them smile marks around our mouth can be more large intestine. So it's an interesting read. We'll have you talk more about that sometime. But meanwhile, Gusho's book is a great little read on it. So pick that one up. Um,
And a good one to have in your waiting room when your clients are looking, waiting for you. My book as well, because of all the colored illustrations that are in the book. Having this literature in your office while your clients are waiting for you, they pick it up and they say, gee, I saw this in the book. What can we do about this? Or, gee, someone in my family or a friend has this. I'll have to tell them about you. So we need to educate our clients as well.
Mhm. So some last questions here. Is there, when there's an itch under the fingernail, does that indicate anything? The itch being the need to pull the tip of the nail back frequently in order to stretch the bed or scratch it?
Wow, that's a new one.
Yeah.
Sorry for laughing. I've never heard about it. But again, any itchy skin is probably a calcium deficiency. And use that vitamin F or those essential fatty acids to drive the calcium into the tissue.
Yeah.
I would start there. My other thought is it could be a fungal infection
Yeah.
because those fungal infections, I've also seen women getting herpes on their fingernails.
Mhm. Wow.
So, the signs of herpes are that stingy, itchy, burning sensation.
Mm-hmm.
So look for an underlying pathology or disease and try calcium. Also try the coconut oil and put it down under there. You can also soak your nails in vinegar. Soak the whole hands in a little vinegar mixed with water, and that might help as well.
Okay. All right.
I'm a big fan of vinegar as a supplement
Yeah.
topically and
Good.
as well.
Yeah. So Janet's saying calcium deficiency for nail itch really makes sense. Thank you.
Oh, you're welcome.
Can parasites be seen in the nails? Some people say that white marks can be a sign of that. What do you think?
Well, if it is, it's because the parasites are eating all your nutrients and you're lacking in zinc. Plus, parasites go hand in hand with a yeast infection.
Mm-hmm.
And so when you have parasites and a yeast infection, you're craving foods you normally wouldn't eat. And a lot of times they're the sugary, starchy foods that these bugs like. And I consider yeast a bug because it's a living organism. I consider infections bugs because a virus is a living organism as well as bacteria. So bowlines, anything can show up on the nails with parasitic infection simply because those parasites are eating all your good nutrients.
Yeah.
So if you feel that you have parasites, I don't always start my clients on a parasite cleanse or any type of cleanse. Sometimes I build them up first so they don't react to those cleanses, especially if they have gut dysbiosis and not good bowel movements.
Yeah.
They're reabsorbing all these toxins that I'm trying to get rid of.
Yeah, music to my ears, Donna. It's very much my approach, and what I teach too is so many people come in so depleted, and we need to help build them up and get them in balance first before they go under more stress and start kicking out the toxins that they need. Really, the energy and the nutrients and the balance to be able to endure and work through
Correct.
successfully. So, thank you. Let's talk about your book a little bit. They're wondering if, what the format of the book is, if it has a lot of photos.
Let me
Things
see,
like
I
that.
think I counted 38 illustrations in the book.
Mhm.
It's only 3 chapters. Let me grab a copy, one moment. I actually wrote this book to be read on an air, from the length of time it takes to ride an airplane from California to New York City. Because that's when I used to do, when I did a lot of traveling for work, that's when I read most of my books. So in my opinion, a book needs to be read in about 3 or 4 hours. So that was my goal to this. And one day I'll come out with the second part of this, which are non-invasive testing. But it's, let me see, how many pages? It's 164 pages, 38 colored illustrations that I actually paid a medical illustrator to do for me because I had to get them exact. The ones that I send out are not from print and demand, the ones that I send out on my website. And I sit down with the printing company on a regular basis to make sure the colors are correct so that you can see the deficiencies. It's highly indexed, footnoted. It has a table of contents and 4 different charts in the back, which are very handy for quick references.
Right, terrific. Janet saying, please hurry with the non-invasive testing book.
Okay. It took me 5 years to write this book.
Sure,
I already wrote. It's a labor of love,
absolutely.
especially to get all those references so nobody can tell me that's not true.
All right. So, this book, you've generously offered a copy of it. And so anybody that's in attendance here today, if you'd like a copy, all you got to do is fill out the survey for us after the webinar ends. And we'll randomly select somebody that was in it, and we'll let you know who that is, and then we'll let Donna know, and she'll mail a copy to you. It could be you.
I
There's
also
also
want to
some,
say, if I might, that I do talk a lot about herbs in the book as well.
okay.
So even though it's nutritional deficiencies, when I know herbs work well for something, we talk about that as well as parasites. So I forget how many herbs are detailed, 20, 30 herbs, but they're all in the index as well.
All right, great, thank you. A couple other questions about part one. Was it archived? Yes, part one of this that was Donna presented 2 weeks ago is already up on our website, so you can listen to that. This is being recorded. It'll be up by the end of the week, so you'll have both parts there. And I
Also,
just have some, yeah.
that I'll be doing 2 more webinars on female health, fertility, postpartum, prepartum, and menopause in August.
Yep. Thank you for that. Oh gosh, Professor Pavka is here, and I just wanted to say she had a comment about your hemoglobin and chlorophyll and B12, and just how similar the molecule is. That hemoglobin contains iron, as you indicate, and the chlorophyll magnesium. B12 has cobalt. Otherwise, the molecule is the same for those three, and it's very interesting because there are three that you really highlight throughout for deficiency's sake throughout this.
Thank you for that comment. I didn't realize that the cobalt had a similar structure, so I'll put that in future presentations. Thank you very
Okay,
much.
there you go. All right, just a few things to wrap this up. Just a reminder that we put on our Hawthorn webinars on the first and third Tuesday of the month, so we'll be back here on May 4th. May 3rd with a conversation with Dr. Susan Brown. She returns to Hawthorn University for another dynamic presentation on bone health. This one is focus is the clinical update on osteoporosis from 2016. Dr. Brown's internationally renowned and definitely an expert in bone health. So it ought to be a terrific webinar. I expect it to be. I'm really glad to have it and to have Dr. Brown back. So join us for that. That's May 3rd and we'll start at 10 till 4 Pacific time as usual with announcements. And And our next All About Alumni is on May 4th with Tara Sheffy on that. So that's at noon Pacific time, and I hope you'll join me for that as well. And perhaps we've inspired you some to learn more about health and nutrition, to learn about some of these deficiencies, to learn about non-invasive testing and various assessments. If we've piqued your interest, check out our website for the courses and programs that we offer in holistic health and nutrition. I think that's it for the day. I really appreciate everybody being here and taking the time. We love offering these and putting it out there and making it available. I'll look for your comments tomorrow. In the meantime, I'll see you back here in a couple of weeks. Thanks, everybody. Thank you, Donna Wild. Take
You're
good
welcome.
care.
Bye-bye.
Bye-bye.